Hello, everyone. Welcome to today's lecture on the nursing profession. I'm excited to guide you through these essential topics, which forms the foundation of our practice and highlights the critical role of nurses in health. This also includes um, evidence-based practice and nursing ethics. As we go through this PowerPoint, you guys will be able to answer the various learning objectives found on this page. Be sure to be able to answer each of these objectives because this is testable material. All right, so let's dive in. So some historical background of nursing. Early civilizations believed that illness had supernatural causes. Um, they believed good spirits brought health and evil spirits brought sickness. They believe medicine men treated diseases using chanting, inspiring fear, or opening the skull to release evil spirits. Later in time, Greek civilizations, they created temples which were centers for medical care. Nursing then began to formalize in early Christian periods, and then by the mid 19th century to the 20th century is when Florence Nightingale was found to be the birth of modern nursing as it is today. Today we celebrate Florence Nightingale as a disaster nurse, care provider, educator, manager, consultant, and statistician. Her contributions to modern nursing include identifying the personal needs of the patient and the role of nurse in meeting those needs, establishing standards for hospital management, establishing a respected occupation for women, establishing nursing education, recognizing the two components of nursing, health and illness, believing that nursing is a separate and distinct from medicine, recognizing that nutrition is important to health, instituting occupational and recreational therapy for sick people, stressing the need for continued education for nurses, maintaining accurate records recognized as the beginnings of nursing research. So as you can see, a lot of this, which we still do today, are recognized, and they were pretty much how Florence Nightingale got nursing started. She is not the only historical figure in nursing. There are quite a few uh, nurses that are also key components of the history of nursing, including Clara Barton, who volunteered to care for wounds and feed Union soldiers during the Civil War. She served as a supervisor of nurses for the Army of the James, organizing hospitals and nurses, established the Red Cross in the United States in 1882. Dorothea Dix served as the superintendent of the female nurses of the Army during the Civil War. She was given the authority and responsibility for recruiting and equipping a corps of Army nurses, was a pioneering crusader for the reform of the treatment of the mentally ill. So these, if you look in your textbooks, table 1-1 on page 10 has a list of some historical figures up until Mary Breckinridge, who established frontier nursing and is one of the first, which is one of the first midwifery schools in the U.S. So what is nursing? Nursing itself can be described as a person who nourishes, fosters, and protects, and who is prepared to take care of the sick, injured, older, and dying people. The word nurse originated from the Latin word nutrix, is to nourish. Per the International Council of Nursing or Nurses, ICN, nursing encompasses autonomous and collaborative care of individuals of all ages, families, groups, and communities, sick or well, and in all settings. Nursing includes the promotion of health, prevention of illness, the care of the ill, disabled, and dying people, advocacy, promotion of safe environment, research, participation in shaping health policy, and in patient and health system management and education are also key to the nursing role. In addition to the definition above, at the beginning of the chapter, the ANA describes the social context of nursing. So the knowledge base for nursing practice, the scope of nursing practice, standards of professional nursing practice, and the regulation of professional nursing in its nursing social policy statement. Within today's definition of nursing, we find all the elements of professional nursing. Nurses focus on human experience in response to birth, health, illness, and death within the context of people, families, groups, and communities. It is patient-centered focus, includes physical, emotional, social, and spiritual dimensions. The aims of nursing include to promote health, prevent illness, to restore health, and to facilitate coping with disability or death. So, for example, we promote health. First, you need to know the definition. Health is a state of optimal functioning or well-being, and that is as defined by the WHO. It can be subjective. It doesn't necessarily mean, for example, somebody that's obese can be healthy depending on what's going on with them. So it is subjective, meaning that it is what the person thinks health is. In health, you still have to also know the term wellness. It is often associated with health and is active state of being healthy. Living a lifestyle that promotes good physical, mental, emotional, and spiritual health. And the way nurses promote health include disease prevention. They also educate. They create programs to prevent illness, engage in leadership to promote health. And these are just some examples. Preventing illness. So we know that there are a lot of illnesses out there. There are so many preventable illnesses, and nurses are at the forefront of educating the patients, educating communities, educating families on how to prevent chronic illnesses. That being through working at a clinic or being in a hospital, taking care of a patient that is suffering an illness to prevent any other complications, or community things such as creating promotional or health promotion materials in order to educate patients to prevent illness. Restoring health, and this is one of the biggest ones, right? We restore health, while working in the hospital. We take care of our patients to bring them back to their optimal level. The things that we do to restore health include performing assessments to detect illness, referring questions and abnormal findings to other healthcare providers, providing direct care, collaborating with other healthcare providers, planning, teaching, and carrying out rehabilitation, and then working with mental health and chemical dependency programs. So depending on the type of illness that's going on. Facilitate coping with disability or death. Well, at this point, right, if you're taking care of a patient that, say, for example, had a heart attack, you're going to have to facilitate some coping with this patient's new normal. Like maybe their function will not be at what it was before, and so we need to facilitate on to the patient how they will cope with this new normal for them. Whether that's them going to a cardiac rehab facility or having home health come every day to help them. So it just depends on what's going on, but that is a huge component of nursing. The other component is the QSEN competencies, which are also, they also align with our student learning outcomes that we have as a school, and they slightly, the student learning outcomes don't change per semester for you, but they do, they get, they're more, a little more advanced as you move through the program. The biggest ones with QSEN are patient-centered care, teamwork, collaboration, quality improvement, safety, evidence-based practice, and informatics. And then we add in at Phoenix College, and in Block 1, you're going to learn professionalism, leadership, system-based practice, and communication. So, for example, patient-centered care for nursing in NUR 152, which is Block 1, the SLO is utilize the nursing process and clinical reasoning when providing basic care to culturally diverse adults with an emphasis on older adult patients. And how do we achieve this competency? Examples are, you're going to perform and document a focused assessment. You're going to analyze and interpret abnormal assessment data. Implement provider orders, and demonstrate other examples of patient-centered care, such as having good bedside manner, or asking the patient, which arm would you like this shot on? Having them involved in their own care. Professionalism. So that is employ professional behaviors consistent with legal and ethical guidelines of nursing. Leadership. So describe principles of effective leadership. Coordinating nursing care for multiple patients in collaboration with healthcare team members for the acquisition and achievement of shared outcomes. System-based practice is identifying the major parts of healthcare delivery system. Informatics is identifying the elements of technology and information management used to document patient care and promote safety. Communication. How do you communicate with the team, with your patient, with leadership, with your peers? Crucial part of your nursing journey. Let's see. Teamwork and collaboration. Describe the role of the nurse as a part of the healthcare team. Function effectively within an interdisciplinary team, fostering open communication, shared decision making, and team development. Safety, which is probably the biggest thing in nursing, is safety, because of the type of job we do. Safety is the biggest component that we want to focus on, especially as you're going through the blocks and learning to provide safe patient-centered care. So safety is employees establish safety protocols and plans for selected clinical skills and procedures. Quality improvement, identify quality care indicators used to achieve positive patient outcomes. Examples of this is how to document a Fallmore scale assessment or a Braden scale assessment. Evidence-based practice is explaining the influence of current evidence on nursing practice, selecting evidence-based practice interventions for your patient. And so these are crucial for you to understand, not only because we are teaching you how to achieve these student learning outcomes throughout your course, but also as you move on in the blocks, these are the things that you are going to improve upon as you move forward in the program. Nursing is recognized as a profession based on the following criteria. 1, it has a well-defined body of specific and unique knowledge, strong service orientation, recognized authority by a professional group, has a code of ethics. There are professional organizations that set standards. There's ongoing research, and nurses have autonomy and self-regulation. The different preparations of a nurse include practical and vocational nursing. So these are your LPNs, LVNs. They are licensed. Schools for practical nursing programs are located in various settings, such as high schools or technical or vocational schools, some community colleges, and there are some places like independent facilities that provide this type of education. Typically, they're 1 year, and they do have to pass a licensing exam. Registered nurses are, there are 3 different ways of attaining a registered nurse license or education. So there's diploma nursing, an associate's degree in nursing, and a baccalaureate, or as known as your bachelor's. Um, all 3 of them are prepared to take the NCLEX RN, which is the licensing exam. Um, it is taken by all. It is illegal to practice nursing unless one has a license, verifying the completion of an accredited school and by passing the boards. This is the only way they gain their legal rights to practice as nursing. Diploma nursing, they receive basic nursing education, typically 3 years. They're hospital based. They they no longer are proliferate like they used to be. There used to be more diploma nursing programs in the past, but now with access to a lot of community colleges and bachelor's degrees, they're not as prolific, but they still exist out there. Most associate's degree nursing, they're ADNs, typically 2 year, require some prereqs. Basically, what you guys are enrolled in is an associate's degree in nursing. Then the bachelor's, it's a 4 year program, requires a lot of administrative, managerial, and community health education. So it's an added amount of education from the associate's degree. A lot of nurses who have bachelor's or the BSN can get jobs in administration and managing and community health positions. Graduate education in nursing that is beyond the baccalaureate or the bachelor's, the BSN. This is your master's educated nurse. This is your FNPs or family nurse practitioners, doctors in nursing practice. So this requires schooling past the bachelor's degree. There are different specialties. There can be, for example, for nursing education. So I am a master's prepared nurse who got her nursing master's in with a focus of nursing education. But there are different forms of master's programs, such as master's for family nurse practitioner or for nurse practitioners. So there are different levels and career roles that can occur past the BSN or baccalaureate degree in nursing. Continuing education, so not Arizona, but other states do require nurses to keep their RN license to do continuing education stuff because they require a certain amount of hours that nurses are continuously gaining education. And you'll hear this a lot, nurses never stop learning. So whether your state requires continuing education for your license, you should still always continue to learn. So taking those classes so that you can always have the best evidence-based practice information. In-service education, this happens a lot in hospitals or facilities. Maybe the facility you're working at has a high rate of falls. So The facility itself might have in-services on how to prevent these falls, or maybe there's new equipment that needs to be learned. So in-services are just education that happens while at a facility or clinic or anything. Um, and it might involve practicing skills. So what is nursing practice in the role? Well, nurses are communicators. They're considered teachers, counselors, leaders, researchers, advocates, and collaborators. And I did talk about nursing as a professional discipline. It is considered a professional discipline because of the listed properties. So these are the reasons why nursing is not just a job, but it is a profession. In your book, page 16, box 1-4, tips for thinking, acting, and feeling like a nurse. This is a great list of the qualities and things that you might be doing already so that you can become a nurse. Maybe you're not doing them now, but eventually you're going to be able to think, act, and feel like a nurse. And these are some of the specific aspects that you might see in yourself. What is the Nurse Practice Acts? So the Nurse Practice Acts define the legal scope of nursing practice. They create a state board of nursing to make and enforce rules and regulations, define important terms and activities in nursing, including the legal requirements and titles for RNs and LPNs, and then they establish the criteria for education and licensure of nurses. For example, Phoenix College is an accredited nursing school, and we are governed by the State Board of Nursing. They tell us what criteria we need to meet in order for our nursing students to be able to sit for the State Board exam. These are the different guidelines for nursing practice. So there's standards of nursing practice, nurse practice acts and licensures, code of ethics, and nursing process and other clinical. So the standards of nursing practice, their defined activities are specific and unique to nursing, allows nurses to carry out professional roles, serving as protection for the nurses, the patient, and the institution where healthcare is provided. Nurse practice acts and licensures are laws established in each state and in the U.S. to regulate the practices of nursing. They are broadly worded and vary among states, but all of them have certain elements in common, such as the following. They're there to protect the public by defining the legal scope of practice for nursing, excluding untrained and unlicensed people from practicing nursing. They create a state board of nursing or regulatory body. They define the term and activities in nursing, and then establish criteria for the education. So that is from the previous slide. So the codes of ethic and professional values. So professional values provide the foundation for nursing practice and will guide you in your interactions with patients, colleagues, and the public. In 1998, the AACN identified 5 values that epitomize the caring professional nurse. So altruism, autonomy, human dignity, integrity, and social justice. So just to think about that, if you look on page 21, it's never too early for students to be intentional about cultivating the character that comports with professional nursing. Begin by asking yourself, am I able to commit myself wholeheartedly to securing the interest of my patients even when this entails self-sacrifice? Recognizing that we live in a society with great diversity, am I committed to respecting my patients' rights to make their own decisions about health? Am I able to respect the inherent worth and uniqueness of each individual and population, even when this is difficult? Do I value my own integrity sufficiently to challenge workplace culture that expects me to be less than my personal best? Am I committed to making healthcare work for everyone, especially the most vulnerable? The different nursing process and other clinical judgment models. So the nursing process is one of the major guidelines for nursing practice. You guys are going to get an entire lecture on this. We use the nursing process in pretty much everything we do in nursing. And then we also go into clinical judgment, which is using the nursing process to activate what we do as a nurse. So what are the actions we're going to take? And you guys will learn great pretty much all the care we provide for our patients uses the nursing process in clinical judgment. The NLN, or the National League of Nursing, has identified 10 trends to watch in nursing education. So changing demographics and increasing diversity, the explosion of technology, globalization of the world's economies and society, the era of the educated consumer, alternative therapies, and genomic and palliative care, the shift to population-based care, and the increasing complexities of patient care, the cost of healthcare, the challenge of managed care, the impact of health policy and regulation, the growing need for interdisciplinary education and for collaborative practice, the current nursing shortage and opportunities for lifelong learning and workforce development, and then the significant advances in nursing science and research. Each of these kind of helps you identify kind of what the trends are, how they continue to influence nursing in general. With nursing comes a lot of ethical principles and morals. So you have to identify the difference between ethics and morals. So ethics is a systemic study of principles of right and wrong, conduct, virtue, and vice, and good and evil as they relate to conduct and human flourishing. Bioethics asks questions such as what kind of person should I be? What are my duties and obligations to other people? What do I owe the common good or the public? Nursing ethics, subsets of bioethics, formal study of ethical issues that arise in the practice of nursing. Morals are personal and communal standards of right and wrong. The following are nursing ethical principles. So autonomy, respect rights of the patient to make healthcare decisions. Non-maleficence is avoiding causing harm. Beneficence is the benefit of the patient. Justice gives each patient their due and act fairly. Fidelity keeps promises. Veracity provides honest and accurate information, even if the news is difficult. Accountability, the state of being responsible or answerable for a system, its behavior, and potential impacts. Acknowledgement of responsibility for actions, decisions, and products. Privacy and confidentiality is ensuring the patient's right to keep private and confidential in their care and information. Another thing with beneficence is to do good. So it will benefit the patient that you do good. The purpose of the Code of Ethics for Nurses. It is a succinct statement of the ethical obligations and duties of every nurse. It is the profession's non-negotiable ethical standard, and it is an expression of nursing's own understanding of its commitment to society. So the biggest thing is, as nurses, we follow the Code of Ethics for Nursing. So some ethically relevant considerations include balance between benefits and harms in the care of the patient, disclosure, informed consent, and shared decision making, norms of family life, relationships between clinicians and patients, professional integrity of clinicians, cost effectiveness and allocation of costs, issues of cultural and or religious variations, considerations of power. Here are some examples of ethical problems that you may face. Paternalism, that's, your typical paternity test or a person not knowing who their biological family is, deception, privacy in social media, confidentiality, allocation of scarce nursing resources, and number five, currently we saw this in COVID, right? How were the resources allocated, not just to the nurses, but to the patients? Valid consent or refusal, conflict concerning new technologies, unprofessional, incompetent, unethical, or illegal physician practice, short staffing, beginning of life issues, end of life issues. And these are just some, these are not all the things, all the ethical problems that a nurse might face. What is the function of an ethics committee? So they're there to educate, they make policies, they review cases, they consult, ensure that there's quality care, and occasionally there is nursing ethics research. Conflicts of commitment. The nurse's primary commitment is to the patient, whether an individual, family, group, or community. The nurse owes the same duties to self as to others, including the responsibility to preserve integrity, to maintain competence, and to continue personal and professional growth. Nurses cannot give their patients what they don't have. They must take care of their own basic needs in order to be there for their patients. This is very classic. Now think about what we've heard of nursing, right? Where nurses go 6 hours without using the restroom because they're so busy on a unit. Well, if the nurse is not taking care of their own basic needs, how will they take care of the needs of other people? And so these are some conflicts of commitment. How do we use the nursing process to make ethical decisions? Well, we're still gonna, have a huge lecture on the nursing process. This is very basic. We assess the situation, we diagnose, which means that we identify the ethical problem, we plan, weigh alternatives, we implement our decision based on evidence-based practice, and then we evaluate if what we decided and what we implemented work. The biggest thing for nursing is that you will be an advocate for yourself, for your practice, for your patients. So the primary commitment is to your patient, prioritization of good of individual patients rather than society in general, evaluation of competing claims of patients' autonomy and well-being, representing the patient, promoting self-determination, whistleblowing, and then being politically active. These are all advocacies and concerned in advocacy. What is evidence-based practice, or what is the role of evidence-based practice in nursing? So EBP provides care based on scientific evidence. It's to guide practice, uses the best evidence available. It's for effective care, considers patients' families' preference, values, and engagements for care decisions. And it looks for quality patient care outcomes. What is the difference between research and evidence-based practice? So research is a scientific inquiry. It's a process that uses observable and verifiable information, so the data. It's collected in a systemic manner to describe and explain or predict an event, versus evidence-based practice is actually a problem-solving approach to making a clinical decision using the best available practice or resource. Evidence-based practice blends both the science and the art of nursing so that the best patient outcomes are achieved. Research is conducted to validate or refine current knowledge or to develop new knowledge. So, for example, research may try to validate a past theory, or research might, based on someone's research, they might develop a new theory. The goals of research is to develop an explanation or find a solution to problems. Goals of nursing research itself is to improve care of people in clinical settings. They study people and the nursing process through education, policy development, ethics, and nursing history. Develops a greater autonomy and strengthens the profession. Provides evidence-based nursing practice. And then the goals of research is to build scientific foundation for clinical practice, prevent disease and disability, manage and eliminate symptoms caused by illness, enhance end-of-life and palliative care. While evidence-based practice may consist of specific nursing interventions or may use guidelines established for the care of patients with certain illnesses, treatments, or surgical procedures, the use of evidence-based practice mandates the analysis and systemic review of research findings. Nursing research is needed to find the best evidence, so they do go hand in hand because we need the research to be able to figure out if this is best practice. How is evidence-based practice done? Well, step one, you're going to formulate a burning clinical question. Most common method to formulate a question is using the PICO model. Step two is search for the best evidence. Step three is critical appraisal of the evidence. So asking if whatever research you find, does it make sense to your burning question? You ask the three questions. Are the results of the study valid? What are the results? Will the results help me in caring for my patients? Integrate the evidence with clinical expertise and patient family to make the best clinical decision. Evaluate the outcomes of the practice change based on evidence, and then disseminate the outcomes of the evidence-based practice change. One of the easiest ways I like to explain evidence-based practice is if you were a nurse maybe, or if you have been in the clinical setting maybe like 15 years ago, you would have noticed that every single patient admitted to a hospital, they had a fully placed an indwelling catheter. Later on, through evidence-based practice and research, it was found that it is more dangerous to place an indwelling catheter for somebody that doesn't need it because of the risk for infection. And this was done through evidence-based practice. You know, somebody had the question of, why are all my patients getting septic? Somebody they researched a bunch of articles and found that it is likely caused by the insertion of indwelling catheters. So now the standard of practice for inserting Foley catheters are only if they are necessary. So unless it's absolutely necessary for somebody to have an indwelling catheter, it is evidence-based practice not to place one. Or if somebody has one placed, it is evidence-based practice to discontinue that indwelling catheter as soon as the patient can have it discontinued. Here is the PICO format. This is for your burning question. So you're going to need a patient population or problem of interest, an intervention of interest, comparison of interest, the outcome of the interest, and a time frame. This is how you start to formulate that clinical question so that you can start an evidence-based project. What's the difference between quantitative versus qualitative? Quantitative involves the concept of basic and applied research. Basic research, pure or lab research, can create or improve an existing theory. Applied research is practical research used to directly influence or improve practice. Examples: pain management, patient education, job stress. Terms used in quantitative are variables, dependent, independent, hypothesis, data, and instruments. There are numbers, maybe graphs and plots and stuff like that. While qualitative is usually conducted to gain insight by discovering meanings based on beliefs that reality is based on perception that differs for each person and change over time. Terms used for qualitative are descriptive, correlation, quasi-experimental, and experimental. And I like to think of qualitative of narrative. So this is like people filling out surveys or to describe certain things so that there can be a narrative that proves that evidence-based practice. How do you read a research article? The first thing is you're going to review the elements of the article, so the abstract, introduction, method, results, discussion, use the references, determine the level and quality of the evidence using a scale, and then decide if the study is applicable to your practice. Check out box 2-4, which has more information on how to read research articles. But this is the conclusion of this lecture. Just make sure you follow along with the lecture notes.